So, what if you could just start over? Build a whole country's healthcare system from scratch, using everything we know today. Sounds kind of like a fantasy, right? Well, some countries have actually tried to do it. And today, we're going to dig into what they learned, what they pulled off, and what their stories can teach us about the future of health for all of us.
Yeah, it's a question most countries just never get to ask. I mean, if you had a blank slate, what would you build? In the 90s, one country got that exact chance. And honestly, their story is pretty remarkable. It's proof that huge, fundamental change, it's not impossible.
Okay, so let's talk about Taiwan. After it transitioned to a democracy, it had this incredible opportunity. And they didn't just wing it, no way. They sent teams all over the world to study what was working and what wasn't in other systems, everywhere from Canada to Germany. They came back with this kind of hybrid plan, and in March 1995, boom, they launched it. The result? A transformation that was just stunningly fast.
So you gotta ask, right? What was the secret sauce here? How'd they do it so fast? Well, it all kicks off with the first and maybe the most crucial piece of the puzzle: access. I'm talking about making sure that every single person can actually get the care they need right when they need it.
Okay, picture this. Before 1995, your health security was basically tied to your job. That was the deal in Taiwan. So if you were a government worker, you were set. A farmer, you had a little bit of protection. But for almost half the people, getting sick could mean financial disaster, total ruin.
And then, poof, everything changed. Today, that coverage number is over 99%. I mean, just stop and think about what that actually means. We're talking about millions of people who no longer live in fear that one trip to the doctor could bankrupt them. That fear, just gone. It's really no wonder the program is so incredibly popular there.
So how does this thing actually work? Well, they went with what's known as a single-payer system. The public library analogy is perfect here. Basically, everyone pays into the system through premiums and taxes, and in return, everyone can check out the care they need from pretty much any doctor or hospital. It's mandatory for everyone. And it's not just for big emergencies. It covers the whole shebang, from dental checkups to your prescriptions and even traditional Chinese medicine.
Now look, getting everyone covered is an absolutely incredible achievement. But it brings up a monster of a challenge. How in the world do you pay for it all? And that brings us to the second big balancing act for any healthcare system: taming that cost monster. And this is where it gets really astonishing. Get this. Taiwan provides this top-tier, universal coverage for just a fraction of what other developed countries spend. They put just over 6% of their entire economy into healthcare. The average for similar countries? Over 9%. So, what's their secret? How are they pulling this off?
Well, they've got this really powerful toolkit for keeping costs in check. For starters, they use something called a global budget. So imagine the government just gives each hospital a lump sum of cash for the entire year. That's their budget, period. It forces them to be super efficient. They also have small co-payments, so you think twice before making a totally unnecessary visit. And they drive a hard bargain when it comes to the price of drugs and medical devices.
But that really hands-on approach that Taiwan takes, that's just one way to tackle the affordability problem. Other countries, they have a whole different philosophy. They focus more on making sure the financial burden on you, the citizen, is as small as possible.
Let's take Croatia, for example. Their system is almost entirely funded by the public. So what does that mean for the average person? Well, the result is crystal clear. Out-of-pocket payments are less than 11% of total health spending. That is one of the lowest rates in the entire European Union.
Okay, so while established systems like Taiwan and Croatia are busy tweaking their models, the real story, the future of global healthcare, is being written somewhere else entirely, in the world's fastest-growing economies.
And that, of course, brings us to the BRIC nations: Brazil, Russia, India, and China. You've almost certainly heard that term before, right? It's the acronym for these massive emerging markets that are really the new engines of the global economy.
So what's driving this huge shift? It's a middle-class revolution. I mean, for the first time in history, you have hundreds of millions of people with actual spending power. And one of the very first things they're demanding is better healthcare. They want insurance, they want modern hospitals, and they're ready and willing to pay for it.
And that creates a truly seismic shift. Think about it. While healthcare markets in wealthier countries are pretty stable, the real explosive growth is happening in these nations. As one analysis from 2014 put it, and they were blunt, for big healthcare companies, focusing on these markets isn't just a smart move, it's absolutely essential for survival.
But here's the thing we keep coming back to. Whether we're looking at Taiwan's efficiency or the explosive growth in the BRIC nations, it's clear there's no such thing as a perfect system. Every single model, no matter how successful it seems, is really just a series of trade-offs. It's a constant, tricky balancing act.
And this really lays out that core dilemma perfectly. You've got Taiwan with its incredible access and efficiency, but now it's facing the strain of an aging population and burned-out doctors. Then there's Croatia, which does a great job keeping costs low for people, but the trade-off is a life expectancy that's still behind the EU average. And finally, the BRIC nations. All that massive growth and potential is up against a huge challenge, just building the basic infrastructure fast enough to keep up.
And really, that brings us to the final takeaway here. Healthcare isn't some problem you can just solve once and be done with it. It's this living, breathing system of choices, a constant negotiation between access, cost, and quality. Every society has to figure out its priorities, and those priorities are always changing. So that leaves us with a final question to think about. What trade-offs would you be willing to make?